that time of the week, Thursdays with Dr. Lillian, and today I'm going to talk about combination skin, and I wanted to change the scenery a little bit from my clinic here at JC Clinic Wellness Center. I wanted to come, get ready for the weekend, enjoy the nice scenery of the Red Sea and the very beautiful view of Jeddah. We're showing you guys. I wanted to share this with you. And I'm enjoying the complimentary tea with chamomile and lavender to relax and just be set for the weekend. So let's get to the point. Let's talk about the combination skin. Basically, combination skin to me as a doctor, I always feel that I'm working with two types of skin. Most of the time it's oily and normal or oily and dry. So basically, in the area of the T-zone area, this is where it's oily. So we're dealing with an oily complexion on the forehead, on the nose, the side of the nose, the chin, and the inner side of the cheeks. And the rest of the skin is either normal or dry. I always feel like I'm working with two types of skin. One is oily and the other is normal or oily and dry. What is the cause of combination skin? Basically, this could be your type of skin type. So genetically, this is how your skin is made. Or it can be induced. So you can induce it by overusing products that are too dry. So you might have like normal skin or you might have oily skin and you overuse products that have a lot of alcohol, acids, or drying materials, and you cause to change the nature of your skin, so the side of the skin might become dry and flaky. So you have an area where it's oily, and then an area where it's flaky and dry. But basically, the best way to treat, or the best way to care for this skin type is using two different products. And I know this from my patient that they come totally overwhelmed. So we try to tone it down, things that are not too drying and not too oily. And this can be a difficult thing to accomplish. So I like for cleansers, the best way is that to clean the area where it's oily with an oil, like a cleanser for oily skin. So basically a gel or a form, and if it's dry on the sides, you use a more of a lotion type. To simplify this, there are cleansers out there for combination skin. So basically, it doesn't totally take away the oiliness, and it doesn't totally dry out the skin. And maybe this is the best for most people, unless there's a problem. And this can be compensated later. And how I compensate, so basically I like them to use cleansers for combination skin, and they usually come in a gel form, and another form is the micellar solution. Now, when they feel too dry in the T-zone area, they can use afterwards a mattifying lotion. So this kind of absorbs the oil and makes more control of the oiliness in the skin. And then in the areas where it's normal, they don't need to use much of a moisturizer, but if it's dry and flaky, then they can apply a light moisturizer for acne prone skin or for oily skin. If that is not enough, then they go a little bit higher, so they can use a moisturizer for normal skin. This would be the best way to treat. Now, if there is a problem, something like there's acne and they are prone because the mid-zone is acne prone and it can clog the pores if you use too much of a moisturizing treatment or moisturizing cream, then it can be treated with acne products, and we discussed the acne treatments or acne, how to care for acne skin in another episode. Most likely to be in the next one. So that's basically for skincare at home. Weekly, if they feel that they have overly dry, flaky skin and they need to remove all that dead skin, they can use an exfoliant. In this situation where they have combination skin, I don't mind if they use a chemical exfoliant with alpha hydroxy acid, but if they become too dry in some areas, they can just compensate for that with a moisturizer. Or they can use a scrub, and that kind of removes all that dead, flaky skin in the dry area and also cleans the pores. So that would be the perfect one, and once a week is more than enough in this skin type. So that would be the home care. Now they can use, if they feel like they need something more, they can use a mask that is a hydrating base of it, a water base, not an oily base. So they don't clog the pores. At the same time, they give some sort of hydration, but at the same time, it does not give them an adverse effect. So they can do that also once a week and as needed. Now, if we want to talk about treatments in the clinic, I like the medical facials, especially in the skin type, because a good certified beautician that knows what she's doing, she actually would be able to identify that this is an oily area and this is a more dry area or normal area, and she uses 2 different types of products on each area according to its need. But the deep cleansing will help in these patients, and then the hydrating and the sebum regulating serum that they apply during these facials will help to give a freshness and a healthy glow to combination skin types. That's for the facials. Now, sometimes if they do have a lot of flakiness and dry dead skin on the face, and they also have some clogging of the pores in the middle side of the face, a good chemical peel will help, but they will need to moisturize after with a water-based moisturizer. So that can be also done to them according to the need. Also, microdermabrasion might help in these patients as well. But now, if we want to talk more advanced medical solutions for patients with combination skin, sometimes I like using microneedling radiofrequency, especially in the areas where they have the pores, because in that area it can decrease the pore sizes and also cause shrinkage to some of the oil glands or the sebaceous glands. And at the same time, it causes rejuvenation of the rest of the skin and stimulation of collagen production, so it can be an anti-aging solution for combination skin. But we have to choose the cases that would benefit from these situations, from these devices. So with this, I kind of came to the end of the how to care for combination skin, and also how to what are the medical treatments in clinic that are available for the skin types. The best way is to discuss all these solutions with your dermatologist. With this, I come to the end. Have a great weekend, everyone, and don't forget to subscribe and like and share. See you